Hi everyone, my name is Madison Connolly. The topic that I have decided to talk about today is child life interventions with acute lymphocytic leukemia, and the medical preparation is for school-age children. So in my introduction, I talked about how child life professionals specialize in understanding the development of children and youth while helping cope with medical procedures and providing emotional support. The primary goal of preparation is to reduce the fear and anxiety experienced by a child who is undergoing um, a medical procedure to promote his or her long-term coping and adjustment to future health challenges. A common diagnosis that is seen in pediatric populations is acute lymphocytic leukemia, and upon the vast importance that CCLSs hold is providing developmentally appropriate education to children with all diagnoses. We will take further look into the preparation for this specific diagnosis for school-age children. So first I wanted to go into a little bit of background with school-age children. So children from 6 to 12 years of age are in the industry versus inferiority stage of Erickson's stages of development. Fear of parental separation can be overwhelming during their time in healthcare settings. The loss of control can also be an issue for this age group since they are learning to be more independent and value their autonomy. School-age children begin to understand pain, injury, and death during this time. This can lead to children in this age group developing fears and expressing them through regression of previously mastered skills, anger, depression, and withdrawal. And CCLSs can use medical play and group play sessions to help the child gain an understanding of their condition and further decrease their fears. And then I gave a little bit of background about acute lymphocytic leukemia. So it is a leukemia or cancer that is sudden and fast growing. It's a cancer that affects the white blood cells, which fight off infection in the body. When a child is diagnosed with ALL, the white blood cells change into leukemia cells, and leukemia cells do not fight off infection in the body like normal white blood cells do. This can lead to pediatric patient feeling extremely ill quickly, and it requires immediate treatment. A treatment that is effective in fighting ALL in children is chemotherapy, and chemotherapy is a drug treatment that utilizes a combination of medications to combat the multiplying cancer cells in the body. So school-age children frequently missing school, time spent with friends and loved ones, as well as the physical side effects from treatment can really affect their development. And although this treatment is used to combat the harmful cells in the body, it often affects the healthy cells as well, which give an individual the hair on their body and some of their energy levels. So this can really affect a child in the hospital, and child life play-based interventions and education really help in alleviating some of these symptoms and consequences of chemotherapy and acute lymphocytic leukemia. So some child life play-based interventions that I talked about were diversion, virtual reality goggles to help redirect attention of children in the hospital, positive affirmations, diagnosis education with medical play, such as an IV start on a teddy bear to administer the chemotherapy. If the chemotherapy is being administered through pills or capsules, a child life specialist can use candy or mini M&Ms to encourage the child to take the pills and then develop mastery. And another thing I talked about was music therapy to express feelings of emotion, and then that further improved play. So then I went into medical play, and children may understand the steps and process more clearly with developmentally appropriate language and play. Medical play alleviates fears and leads to more future success with hospitalization and treatments. CCLS can build a sense of trust and rapport with the child through medical play, and the child also gains competence and has a higher success with future procedures and hospitalization. And then I touched on how this has related to our previous topics when we spoke about palliative care. Palliative care includes providing pain and symptom management, alleviating fears and anxieties, offering emotional support to patients and families, and helping patients to be comfortable whether they are in the hospital or at home. So the goal is to help patients be comfortable in the hospital by including family and collaborative activities, advocating for normalization of the environment, and listening to their unique needs. So CCLS provides all these concepts into the hospital for pediatric care, and I think that they go hand in hand with palliative care. And then I just have some references, and that is basically the sum of my paper. So I appreciate you guys watching, and I've had a great quarter with all of you, and I hope to see some of you guys again in the fall. Thank you. Bye.